But so the primary outcome measured is reachable workspace. And so that's that, can you put your hand up, over, back, and it measures it actually measures 5 quadrants, which is interesting because you think of 4 quadrants, but you also measure that reach back and kind of reach behind. And so that's done with actually an Xbox Connect machine. And so it measures kind of where can you reach. And then they're also looking at patient-reported outcomes. There's a specific questionnaire. It's a quality of life questionnaire that we're utilizing, and it's actually specific to FSHD. So Northwestern University is creating that tool, which I think is pretty cool. And a lot of our patients are providing input to the creation of that tool. So it's going to be a specific to FSHD, which we need to do more of, right? We can't just have these basic photocopy questionnaires that everybody is getting that came out of the cancer world usually, that asks how you're feeling and if you felt depressed. We really need to get into particulars about each disease. And then also still looking at MRI and muscle fat fraction, which is the replacement of fat in the muscle area. I think imaging is going to be something very important when you can start making correlations between the loss of muscle and loss of function, or gain of muscle, gain of function, hopefully someday. My guys have been in an MRI study for a number of years where they were attempting to kind of correlate those things, because the less invasive you can be with these studies, the better, of course. And the thing that we've dropped is the muscle biopsies. So in our original study, we did not see a noticeable reduction in DUX4. There's a lot of chatter about that. People didn't love that. But I also think that we don't know how to measure biomarkers yet. We don't know how to, we don't really know how to capture it once it gets out of the lab. And so we continue to look for ways to do that. And I think biomarkers are incredibly important, and we keep, looking at them. But I think if you're going to look for perfection, like we were almost forced to with dystrophin, in how to quantify, you're going to miss out on a product that's good enough, right? That we know works, but we don't know how. And then there's a number of other secondary endpoints, and then some chatter about, other ways to partner with the community to do other clinical trials, to look for other data. But I think less is more in this situation.